Thank you for joining us for the Fall Enrollment webinar. My name is Brene. I am a benefits educator here with the Employees Retirement System of Texas. But we are going to record the presentation, and that will be posted on the ERS Fall Enrollment webpage. And then there are some materials available for you. If you look in the materials section, there is the PDF version of this presentation available there, and then also some comparison charts for the medical, the dental, and the vision plan. And then we'll briefly talk about the premium rate increases. There is a handout associated with that in the material section as well. And then you should also see that there are the rate sheets available in there. So everything that you need to know in regarding fall enrollment is available in that material section. This presentation is meant to give you an overview of all of the benefit options that you have. If you're wanting to get more detailed information about each of the plans, they will host their own benefit sessions that you can join. So I'm going to go ahead and jump right in so we can get to it. Again, this is the fall enrollment presentation. During this fall enrollment presentation, we are going to look at what you can do during fall enrollment. So what are the things that you have the capabilities of doing? Then we'll also talk about that personal benefits enrollment statement that you should have received in the mail along with that fall enrollment guide. And then we'll talk about the different benefit options that you have available to elect if you do choose to elect them. And then we'll also touch on how you would go about making those changes if you should need to make any changes, and then also point you to some resources. Again, this presentation is meant to give you an overview of your benefit options and what's coming for the new plan year. Throughout today's presentation, I will refer to that fall enrollment guide that you should have received by mail. You will see some page numbers throughout the presentation. That's just where you can find the information in that fall enrollment guide. And then this guide is also posted on the fall enrollment page. And I just realized I didn't put it in the materials, but you can find it in that fall enrollment page, and I will point you to where you can access all of the materials at the end of the presentation. All right, so fall enrollment, this is your opportunity to make changes to your benefits without a qualifying life event like marriage, divorce, a birth of a baby. During fall enrollment, you do have that option of enrolling in a benefit that you don't currently have, changing your plans, or just waiving your benefits altogether. And say you needing to add a dependent, this will be your opportunity to do so. But just know that most of those changes that you do make during fall enrollment do go into effect as of January the 1st. Now, if you are electing life insurance, say you don't have life insurance now and you're electing that during the fall enrollment period, you would have to go through evidence of insurability, which is an application process where you will have to answer questions regarding your health history. Depending on when that goes into effect, will depend on when that is approved, will depend on when that goes into effect. So if you are choosing to have more life insurance, you complete the evidence of insurability process and they give you an approval date before January the 1st, it'll go into effect as of January the 1st. Now, I do want to point out, as a retiree, you do have that option of dropping your benefits at any time. So you can reduce your coverage at any time, waive your benefits at any time, or you also have the option of switching between your medical policies at any time. That's what we like to call freedom of movement. So you can switch between the Health Select Medicare Advantage plan and the Health Select Secondary plan at any time for any reason, just by making a phone call to ERS. Now, we did mail, or you should have received, what's called a personal benefits enrollment statement, or a PBES. This will come to you with that fall enrollment guide. We typically try to mail them in enough time frame for you to review them before fall enrollment starts. So that personal benefits enrollment statement is very important because it does give you the dates of fall enrollment. And then on that front page, it will tell you what coverage you have. So it'll tell you if you're elected in medical insurance, if you have dental, if you have vision, if you have life insurance. It'll go over all of the benefits that you're currently enrolled in. And then it'll also tell you what the cost of those benefits will be come January the 1st. So if you look at that front page and you're like, oh, everything looks okay, then you don't have to take any action. Your benefits will just continue to roll over into the new plan year. But if you're looking at that front page and you're like, what other options do I have available to me? That will also be listed in that personal benefits enrollment statement, and it'll have the cost associated with those changes that you are wanting to make as well. All right. So I did mention if you are wanting to add a dependent onto your insurance, this would be that opportunity to do so. If you are adding any dependent children onto insurance during this time, and you've never had them covered before, you will have to complete what's called the dependent child certification. So this is a certification that indicates the relationship between yourself and that dependent that you're adding on to your insurance. So it's just a click of a button when you go online to add them onto any of your insurance, regardless of whether it's just medical or you're adding them onto just dental or vision or even the dependent life insurance. So they can't be added onto your coverage until you complete that dependent child certification, which again is just a click of a button. Now, if you are adding any dependents onto your health insurance, if they are new dependents and they've never been covered under your health insurance benefits before, they do have to go through that dependent eligibility verification, which is separate from the dependent child certification. So the dependent eligibility verification is administered by our third-party vendor, Alight Solutions. So what they will do is they will mail a packet of information to you. In that packet of information, what they're going to provide you is the name of the individual that's being verified, the documentation to verify that dependent, and then the deadline to submit the verification documents. Very important that you do submit all of the documentation that they are asking for in the time frame that they're asking, because if you don't complete that verification process, that dependent that you're trying to keep covered under your health insurance will be dropped. And not only from your health insurance, but they will be dropped from all of your benefits. Okay, so for an example, if you have your grandchild and they are under your vision insurance currently, and during this fall enrollment period, say that they lost insurance with Medicaid or CHIP or whatever, or with their parent, and you're needing to add them onto yours, they will have to go through that verification process, and there are documentation that you would have to submit to verify them. If you don't submit that verification documentation in time frame, they're going to be deemed as an ineligible dependent in ERS's system. And even though you've already had them covered on vision, once they're deemed ineligible, they're going to also be dropped off of vision insurance. So very, 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 very important that you complete that verification process. And then also any dependent that you're adding onto that health insurance coverage does have to complete a tobacco user status. If they do not complete that status, then you will be charged that premium for them to continue coverage under your health insurance benefits. All right, so we want you to know that you do have options. In the following slides, we'll give you a brief overview of your benefit options. That fall enrollment guide that was mailed to you with that personal benefits enrollment statement will provide you with more details. And then again, our program administrators are going to have webinars that you can join, and I'll give you some more information about that towards the end of the presentation. All right, so first, let's talk about your health insurance. Currently, there are two different options available to you. You have the Health Select Medicare Advantage Plan, which is on that left-hand side of your screen. This is currently administered through United Healthcare. With that Medicare Advantage Plan, it is considered a Medicare Part C, as in Charlie plan. So that means that it works with your Medicare Parts A and B to cover up to 100% of most of your services. You have the same level of in-network and out-of-network benefits. So that means that you can see any provider that accepts Medicare, and you will get the same benefit. Now, one of the also key benefits of this plan is not only do they have to accept Medicare, but they also have to be willing to bill United Healthcare. It's now regardless on if they're in network or out of network, your coverage will still be the same under the policy, but they do have to be willing to bill United Healthcare. Okay. Now we do get asked the question, but what if they're not willing to bill United Healthcare? What are my different options? Well, you do have the option of paying out of pocket and then filing a claim for reimbursement with United Healthcare, and you can speak to United Healthcare about what that process is and the time frame for getting that benefit reimbursement. Now, you and your eligible dependent must be enrolled in Medicare Part A and Part B in order to have that Health Select Medicare Advantage plan. Okay, if your dependent is not enrolled in Medicare, then they will just stick with the Health Select benefit that they currently have. They won't see any changes to their insurance. The second option is the Health Select Secondary plan. This is administered under Blue Cross and Blue Shield. So this plan pays secondary to Medicare, and in some cases pays primary if a service is not covered by the basic Medicare policy. Now, this plan does come with a deductible. So that's $200 per person, $600 per family, and it does run currently with Medicare's deductible, which right now is $240. So once that deductible is met, that's the amount that you have to pay out of pocket before the benefit pays anything for you. Once that deductible is met, Medicare will usually pay 80% of the covered expenses, and of the remaining 20%, Health Select of Texas or Blue Cross and Blue Shield would cover 70% of that remaining 20% that Medicare doesn't cover. So then you would be responsible for potentially 30% out of pocket. Now, if you are like me and all of those percentages go straight over your head, I like to think of it in numbers. Okay. So say you've already met your deductible and you go to Access Services and say that bill is $100. Okay. So Medicare is going to be billed first and they're going to cover 80% of that, which is $80. So that remaining $20, that is becoming Blue Cross and Blue Shield in your responsibility. So Blue Cross and Blue Shield is going to cover 70% of the $20 that's remaining. So that's about $16 that they're going to cover. So that $4 that's left over after they covered would then become your responsibility. Okay. So if you met that deductible and they charge you a $100 bill, the most that you would pay out of pocket for that is about $4. Okay. If you're like me, I like to look at numbers and that side of it. Okay. Now with this plan, in order to get the full benefit, in order for the benefit to work at its maximum, you do have to be enrolled in both Medicare Parts A and Part B. But if you choose not to enroll in either part of that, you will end up paying much more for some or maybe all of your care. So you want to be very aware of your different health insurance options. And as I stated earlier, in that material section, there is a health plan comparison chart. It does give you a side-by-side comparison of both of the options. And it not only goes over like your medical benefits, but it also does speak to mental health benefits, diabetes coverage, and also your prescription drug coverage, which we'll talk about in a second. Now, one thing that I do want to go over is if you already have health insurance. Now, if you do have health insurance, say with like another employer, and that health insurance is not Medicare, you can choose to go with the health insurance opt-out credit. So what that does is that states that you have comparable health insurance outside of the state of Texas that's not Medicare, and you're going to be waiving your health insurance, the life insurance, which is a $2,500 policy. And then you're also going to be waiving that prescription drug coverage. But in return, what the state is going to give you is a credit of up to $60 if you are a full-time retiree, and then a $30 credit if you are a part-time retiree to go towards your vision and your dental insurance premiums if you do have those benefits elected. Now, say you do have that comparable health insurance, but you don't have like any dental or vision with us, then you may not want to choose the opt-out credit. You may just want to waive your health insurance altogether. Okay, so we do have to let you know that due to the rising health costs, the rate for the Health Select Medicare Advantage plan is increasing by 2.3%. But even with that increase in the health premium, it is still much lower than the cost of the plan was in 2020 before United Healthcare took effect. Excuse me. That's an increase of $2.74 a month for a retiree with 100% state contribution and with a spousal coverage. So if you have your spouse on your Health Select Medicare Advantage plan, you'll see a slight increase of about $2.74 come January the 1st. The Health Select of Texas plan premiums will increase by 8%. Now, this will be the first meaningful increase since plan year 2017, even with all of the plan enhancements that have been happening. So that is an increase of $28.64 a month. And that again is with the state covering the retiree at 100%, and you're having your spouse covered under your insurance. Now, even with the change in your insurance premiums, the group benefit plans, also known as GBP plans, which is what you have with the state of Texas, they're still being maintained to continue to enhance the benefits that you are receiving. So even with the improvement of coverage and no increases in copays and no increases in like co-insurance, which is that potential out of pocket, or even with the deductibles, there is a slight increase, but your benefits are still enhancing as well. If you do want to know what the costs for either of the health plan insurance are, again, there is a rate sheet attached to the material section if you are attending this live. If you are listening to the recording, you can find that information on the Fall Enrollment webpage, or you can also look in that personal benefits enrollment statement as well. Right. So with your enrollment in either of the health insurance plans, you do get prescription drug benefits. If you are enrolled in the Health Select Medicare Advantage plan or have the Health Select Secondary, you do have the Health Select Medicare RX benefit. This is considered a Medicare Part D, as in David, prescription drug coverage. If you are wanting to get like more detailed information than what you see here on the screen, they will have a benefits Q&A session or benefits Q&A session that you can attend to ask them more detailed questions. But just while you're here, what we can go over is just some of the basic information. So depending on your level of prescription that you're getting, is going to depend on the copay that you have associated with there. There are currently 3 different tiers. Tier 1 is the typically lower cost generic drugs. Tier 2 is usually your low cost preferred brand name drugs. And then tier 3 is the non-preferred brand name drugs with the higher cost. So of course, if you stay on tier 1, your copay is going to be lower. One thing I do want to mention is that with this plan, it does have a deductible that does reset at the beginning of every year. So there's a $50 deductible that resets at the top of the year. So if you are going to access services at the beginning of the year and you're like, why is my out-of-pocket so high? That's because that deductible reset for you. As I stated earlier, if you are wanting to get more information, of course, you can look at page 9 of that fall enrollment guide, but they will also have a benefits Q&A session with Express Scripts, and that will happen on October the 29th at 2 p.m. So they will have a webinar on October the 29th at 2 p.m. So you do have the option of registering for that webinar. Right. You also have the option of enrolling into dental insurance. So with the dental insurance, in order for any eligible dependents to be enrolled, you do also have to be enrolled into that plan. They don't have to have the same dentist as you, but they do have to have the same dental plan that you have. Currently, there are two different dental plans that you can choose from. You have the State of Texas Dental Choice Plan, which is a PPO plan. Participants are not required to designate a primary care dentist, and you can also see any dentist that takes the PPO dental plans. Or you have the Delta Care USA DHMO plan that does require you designating a primary care dentist, and you can only access services from that dentist that you have. Now, I do want to mention with that PPO plan, you can access services anywhere within the United States, Canada, and Mexico. And then you do have access to both of the networks that you see on the screen, either the PPO network or the Premier network. Of course, if you stay in network, your out-of-pocket will be less than if you go outside of the network. It will cover outside of the network, but staying in network always helps you with your out-of-pocket expenses. And then with the Delta Care USA DHMO plan, that one is only good within the state of Texas. So if you do have someone covered under your benefits and they do travel outside of Texas, they would only be able to use that service by coming into Texas to use that. And then very important, because with this plan, you do have to designate a primary care dentist. You want to make sure that that dentist is in the Delta Dental network before you set up an appointment and with them. Okay. If you are wanting to get more information about either of the dental plans, you can see pages 10 through 11 in that fall enrollment guide, or you can also attend the Delta Dental Benefits Q&A session on November the 2nd at 2 p.m. to get more information. All right. And then the state of Texas Vision, we currently only have one separate vision policy that you can enroll in. This is currently administered through IMED. If you do wear contacts or glasses, you do save money with the vision plan. You do get one eye exam per year, and that does come with a $15 copay if you see an in-network provider. The plan also includes a $200 retail allowance towards your eyeglass frames or your contact lenses, and that also can only be used once per plan year. There are some discounts for LASIK that you can take a look at on their website. Now, if you are wanting to get more information about those potential discounts or providers that are in your area, you can take a look at page 12 of that fall enrollment guide. You can also, if you are listening to this as a recording, you can take a look at the vision comparison chart, or if you're attending live, you can look at the vision comparison chart in the material section. But IMED will have a webinar on November the 5th at 2 p.m. That way you can actually speak to an IMED representative directly. Well, not speak to, type in your questions like you're doing now with an IMED representative directly. And then lastly, we do want to go over your additional life insurance options. This is administered through Securian currently. If you do have either of the health plans, whether that's the Health Select Medicare Advantage plan or the Health Select Secondary plan, you are enrolled in a basic term life insurance policy of $2,500. That doesn't cost you anything. If you do currently have the optional term life insurance, you can continue with that election, or you can also choose to decrease that optional term life insurance or switch it over to the retiree fixed life insurance policy. But just remember, if you do choose, so say if you have election 2 currently and you choose to reduce it to election 1, you can never increase it back. So you can never go back to election 2. Once you decrease, you can never increase it. We do want to also let you know, we'll talk about this a little bit more in the next couple of slides, that at the age of 70, if you do have that optional term life insurance, the amount of that optional term life insurance automatically begins to decrease every 5 years once you hit the age of 70. And then Once it does get to around $10,000 worth of coverage, or we see that that's going to drop below $10,000, ERS does automatically switch you over to that retiree fixed optional life insurance. You don't have to do any type of evidence of insurability or anything of that nature in order for that change to switch. But if you are wanting to, or if you don't currently have any type of life insurance elected, you can choose to go and enroll in the retiree fixed optional life insurance. It is an amount of $10,000 that will be paid to your beneficiary. That current premium is $24.80 a month. If you don't have any type of additional life insurance and you're wanting to elect that now, you would have to go through what's called evidence of insurability, which is an application process regarding your health history in order for that benefit to be approved. If that approval happens before January the 1st, then it'll go into effect as of January the 1st. If the approval happens after January the 1st, then it will just take effect the first of the month after that approval date. Right now, before we go into the changes of that life insurance once you hit the age of 70, we do want to also go over the life insurance option for any eligible dependent. So this policy will pay you $2,500 upon the death of that dependent. Currently, it is $3.23 per month. If you have a dependent enrolled, currently their coverage will continue to go unless you choose to drop it. Otherwise, you do have during your fall enrollment period to elect them onto that benefit. With electing them onto that benefit, they would have to go through that evidence of insurability, again, that application, in order for that benefit to be approved. No matter how many dependents you have covered under there, you're only paying that one set premium, which is $3.23 per month. All right, now, we do get a lot of questions regarding like the changes of the life insurance, what type of policy it is. Well, that optional term, it is a term life insurance policy if you're having it at 1 times or 2 times your annual salary. And then at the age of 70, it does start to decrease, but typically as the percentage or as the policy amount is decreasing, the amount that you're paying for it is increasing. So there may become a point to where you may want to take a look to see if it's even beneficial for you to have that at the time that it's getting ready to change. And this is all based upon your birthday at the beginning of the fiscal year. So say you are currently 69, fall enrollment is happening. Your birthday is not until January the 2nd of next year. So you won't see a change in this upcoming fall enrollment, but you will see a change next fall enrollment because you're going to be at the age of 70. Okay. And then in that personal benefits enrollment statement that you receive, it will tell you what that new amount is going to be because of that age change. Now we do want to point out to double check or look at your beneficiaries, look into your ERS online account. So if you're a retiree with the state of Texas, that means that you're getting a monthly benefit from us. You would have designated beneficiaries for that. But then sometimes people forget that they also have a life insurance policy with us. So you want to make sure that you do update that policy for your life insurance. And that can be updated at any time by either logging into your ERS online account or calling ERS to get that updated. Okay, that can happen at any time. We want to make sure that we're paying out this life insurance policy that you're paying for to the correct individuals. Okay, so I know that I've given you a lot of information, but we do want you to know you can actually attend a benefits Q&A webinar. These are through our platform, but they are going to be with the actual program administrators. And these are excellent resources for you to get information directly from the source. So they will have a brief presentation, and then the rest of that time is dedicated to your Q&A. So the rest of that time is dedicated to answering any questions that you may have about the plan, about some of the benefits that you get with that. So you do have access to registering for that before the events take place. Okay. And there should have been some information in that PVS and that fall enrollment guide on how you register. If not, I will also show you how to do that on the website. In addition to the webinars, ERS benefit educators like myself, Jennifer, and Jorge, we are benefits educators. So we will be traveling across Texas. Well, not really across, just to a couple of places across Texas with our program administrators to provide information to you face to face. You and your dependents are welcome to attend any of the 4 Staying Connected events. So typically, we typically do fall enrollment webinars fall enrollment fairs, every year. But then every legislative year, we have the Staying Connected events, which are for all retirees within the state of Texas. So they can come out. We will have presentations from each of the health plan administrators. We'll also have presentation from our executive director, Porter Wilson. So you are welcome to come and join any of the sessions. Please come out, get some great information from the actual program administrators face to face, speak to us at ERS face to face, and then also hear some great information from our executive director, Porter Wilson. You can find a list of that in that fall enrollment guide, but there is also something in the material section that has the event information. And then this information was also mailed out to you. With you being a retiree, you should have received a Staying Connected invite through the mail. You don't have to register for it. You can just show up and get some of the goodies that our program administrators will have, and us at ERS as well. All right. I know I went over a lot of information. So if you're not planning on like attending a Staying Connected fair where you will have the option of making those benefit changes with an actual ERS representative, you do have other ways to make those changes. You can log it into your ERS online account to make the changes starting today and going all the way through the end of fall enrollment. Just by logging into your ERS online account and following the prompts, or you can also call toll free at 866-399-6908, or in the back of that fall enrollment guide, there will be a fall enrollment election form. You can complete that. Complete it, rip it out, send it back to us by mail, or drop it off to the ERS building by November the 14th. I mean, if you're coming to the building anyways, you can ask to speak to someone and help you process those changes as well. Okay, but you can find more information on how to go about processing those changes on page 3 of that fall enrollment guide. All right, so as I said, I'll point you to some resources. Email, you can always email ERS. If you go to the ers.texas.gov, in the upper right-hand corner, you will see the Contact Us link. You can click on that Contact Us link, and that's on top of any ERS page. And then you can just put your information in there and request an email to be sent back to you. It's on a first come, first serve basis. That's put into a queue for that to happen. Or you can also give us a call. Again, at 866-399-6908, Monday through Friday from 8 a.m. to 5 p.m. Central Standard Time to get in contact with a customer service representative. If you're wanting to get more deep information, once you call into customer service, they can route you to the correct department. If you are wanting to get access to the program administrators, their information is going to be on page 16 of that fall enrollment guide. It has not only their phone numbers, but also their website information for you as well. And then ERS website is always a good resource for you. If you do click on ers.texas.gov under that What's Happening Now section, you'll see the Fall Enrollment 2026 site. Once you click on that, it'll take you to the fall enrollment webpage where you can get all of your materials and access all of the resources available to you with this enrollment period. Again, fall enrollment starts today, and then it does run through November the 14th. Right now, on that fall enrollment page, you'll have access to all of the comparison charts. You'll also have the PDF version right now of the fall enrollment presentation. This will be recorded and posted on there within a couple of days. And then we do also have the plan administrators presentations that they're going to do during the webinars are on there as well, so that you have access to that. And then you also have access to the link where you can go in and register for any of the benefit Q&A sessions that interest you, or if you're just wanting to get more information. Now, if you still have questions, you do have many resources available to you. But one good thing that you have available to you to help answer any of those questions is going to be that fall enrollment guide. It does go into more in depth than what I did here in the webinar today. And then also that personal benefits enrollment statement is going to give you exact figures of what you will pay for any of the benefits that you do choose to enroll in. Pay attention to any handouts that came with the fall enrollment guide and that personal benefits enrollment session, personal benefits enrollment statement, excuse me. And then you can attend a benefits Q&A session. You can also come to a Staying Connected fair. You can visit the plan's websites. You can also contact the plan administrators to get more information. So there are plenty of resources available to you to kind of help you answer those questions that you do have during this enrollment period. Okay, so I do hope that this information has been helpful. Thank you for joining us today.